Hi dear students, good morning to everyone. Today we are going to see another one important topic from the subject clinical orthopedics. Understanding of this topic will be more useful. How various skeletal problems are solved in the clinical sides of orthopedic management so that we can efficiently plan our physiotherapy program. So the topic that we are going to see today is a type of clinical management procedure. The topic is bone grafting. Bone grafting, the name itself, tells us one thing, that a bone from one place is taken and it is replaced onto another place. That is what is grafting, bone grafting. In order to treat certain problem in the skeletal structure. Okay, so we are going to elaborately look at it in this video based lecture. As I told you, bone grafting is nothing but replacing or transferring a piece of bone from one place to another place where there is a problem and treat the problem. This can be taken in three forms. For example, if the bone is taken from the same patient's body, okay, there is a problem in one part of the body, so in order to treat that, they take the bone from one part, another part. This is called autogenous graft. Autogenous graft. Simply autograft, we can call it like that also. Suppose if the bone is taken from another patient, another person, a healthy person, if that bone is taken and it is applied onto this patient. Suppose if the same patient's from the same patient's body, the bone cannot be taken due to some reasons, clinical reasons. In that case, they will take the bone from another person. This kind of graft is called as homogeneous graft. Okay, from human being to human being, homogeneous graft. There is also another type, the third type, which is very rarely performed. That is the one where the patients, in order to treat a particular patient's skeletal problem, they will take the bone from a non-human organism, from the animal. Usually the bovine source they will choose. They will take from the bone from the bovine origin and they will put it. Due to some lot of antigenic reactions, this third type is not commonly done. Okay, and this kind of grafting is called as allograft, otherwise called heterogeneous graft. Okay, the three types of grafting methods we have seen. They are autograft or autogenous graft. Number 2 is homogeneous graft. Number 3 is heterogeneous graft. Okay. Coming to the indications, why this bone grafting, when the bone grafting is indicated, when the procedure is done, the three important reasons for which the bone graftings are done. Number 1, to treat the non-united fractures. Okay, the fracture is not united due to various reasons. Even in spite of various clinical management procedures, it is not united. To treat the ununited fracture, we use bone grafting. That's the first important indication. Number 2, to treat a failed arthrodesis procedure. We all know arthrodesis is a procedure where a joint is no longer needed because of pain or severe deformity. We want to fuse the joint. Okay, well, normally the articular surface, articular cartilage part will be shaved on both the ends of the joint. Then they will immobilize and it will be fused. Suppose if this procedure fails, so at this point of time, bone grafting can be indicated. They will use the bone grafting to fuse the joint. Number 3 is to correct any defect or cavity in the bone. Due to road traffic accident or some other reasons, the bone, when the bone is severely damaged or cavity is formed, to treat that we use bone graft. The 3 indications commonly. Okay, so when they use the bone grafting, how the bone is taken? The 3 forms the bone is taken. Number 1, the bone can be taken as a solid slab. This is called strut grafting. Strut graft. Solid bone. They will take a piece of bone from the cortical bone, usually cortical bone for this type. That is called strut graft. Usually the strut grafts are taken from the subcutaneous portion of the tibia or the head of the femur. Head of the femur is taken only when the patient is undergoing a hip replacement surgery. In those patients, the head of the femur is no longer necessary, so they will cut it and take out. They will fix it with the prosthesis. So this taken out portion of the head of the femur can be used as a strut graft for another patient. Okay, either subcutaneous part of the tibia or the head of the femur can be used. Another type of bone, the variety of bone, the type of bone they take from the bone during bone graft is stripped graft. Strip means slices. They will slice a portion of the bone and they will take it out. This is called strip graft. S-T-R-I-P, strip graft. Usually the cancellous portion of the bone will be taken. The most commonly used portion for this type is the iliac crest of the hip bone. The third type is chip graft. The bones will be taken from small chips and that will be given to a donor. So this portion also mostly the cancellous bone, mostly it is taken from the iliac crest of the hip bone. So totally the 3 varieties they take the bone graft. Okay, solid slab, that is called strut graft, S-T-R-U-T, strut graft. Number 2 is in slices they will take. It is a cancellous bone and that is called strip graft. Number 3 is chip graft, that also a cancellous bone that is taken from iliac crest. Okay. How the bone graft works, that is a very important thing which we have to understand now, how it is working. When the new bone is applied on the area where there is a problem, how the bone works. Normally, if you see the bones, the new bone, when it is transferred from one place to another portion, the cells will not live for longer. They all will die. However, from the clinical observation, even though most of the cells are dying, few cells might escape and they will live. Okay, that's a positive sign, positive side of the bone grafting, number 1. Number 2, not only that, all the bone cells which are used as a bone graft will help a new bone to form over there. They serve as a bridge from one part to another part. They stimulate and help a host cell. That means the affected site, the cells of the affected site to develop, to proliferate and form the new bone cells. So indirectly they help. Okay. Number 1, some cells escape and they live for longer. And okay, number 2, they also help for the new cells to develop as a bridge over the bridge, so that at one point of time over the bone grafted site all the cells will become a newly formed cell which are from the host. By the time the cells of all the bone grafted area, bone grafting, the replaced cells all will die. However, the site is already treated, already healed. Okay. In this clinical observation, they also found one thing, that when the bone grafting is done, if it has to be successful, it is very important the place where the bone is replaced must have enough blood circulation. This vascularization is very important. If it is fully vascularized, the surgery will be successful. If it is not, if it is ischemic, partly ischemic, then the success rate is gradually correspondingly reduced. So they identified the new techniques in the bone grafting has identified that whenever the bone is taken from one place, it is better to take along with the soft tissue connected with it as well as the blood vessels connected with it, so that when they take along with the soft tissue and put it on the new site, what happens, and the soft tissues are sutured with the existing soft tissue around the affected area, the blood vessels form new anastomosis, so that the new blood circulation develops immediately and the healing process becomes more faster and effective, and the success rate is very high. This is a new advanced technique in the bone grafting method. Okay, so that's it about the bone grafting surgical method, clinical method, the most commonly performed clinical management procedure. I hope this would be more clear for you, for your understanding. Look at this video many times, and I'm going to post a small activity about it, along with it. So do that activity also. Okay, enjoy your holidays and have a nice day. Thank you.